Hi, my name is Dr. Davina Kotulski and I'm a licensed clinical psychologist. I have a private practice in the Pasadena, Los Angeles area, and I also have a specialty working with LGBT people and their families around coming out issues and addressing the specific issues that come up with LGBT people because of the inequities and the discrimination that LGBT people experience. Have you had any of these challenges as a therapist? Have you found that you don't know which words to use when speaking to an LGBT client? Perhaps you're afraid that you might offend your client by using the wrong language. Are you confused or overwhelmed by the alphabet of terms like LGBTIQ and not really know or aren't clear on what they stand for? Or perhaps you believe that LGBT people should work specifically with an LGBT therapist as opposed to a non-LGBT therapist. In this course, you're going to learn all the terminology that you need to know when working with LGBT people and what words to use and what words to steer clear of. Even well-meaning therapists can make mistakes. Having a caring, well-meaning therapist is important, however, it's not enough. As many minority groups know, even a well-meaning therapist can make mistakes if they are not educated about the important situations that this minority group faces. So it's extremely important that therapists not make assumptions and attribute every psychological issue to minority group status or to being LGBT in this situation. It's equally important that therapists not underestimate the impact of being LGBT and how that impacts a client's psychological experience in the world. Minimizing the impact of bullying or discrimination or oppression can equally hurt a client. So it's important that a therapist be able to look at the situation a client is facing and be able to identify what are the specific stressors to an LGBT person because of their minority status, and what things have nothing to do with LGBT status and have to do with other psychological or social stressors. Okay, so in other words, many gay people have entered therapy and found that therapists just want to focus on their being LGBT. And it's important that that not be the exclusive focus of the therapy. Sometimes clients experience that therapists who don't have enough experience working with LGBT people may come across like voyeurs. Certainly I have had clients report that they've had that experience when working with undereducated or uneducated therapists who are not a part of the LGBT community. And personally, in my own therapy, I've had that experience where therapists are using the time to educate themselves and sort of peek in or satisfy their own curiosity about LGBT people rather than focusing on the clinical issues at hand. So again, it's important that therapists understand each client's specific experiences, and there's a difference between getting to know a client and to know their specific worldviews and experiences and using the client to glean information and to educate themselves. Again, we should be, as therapists, educating ourselves outside of our client hour about the needs of the population that we work with. Additionally, it was not uncommon in the past for heterosexual therapists or non-LGBT therapists to attribute pathology to the reason why a client would be LGBT. So the myth that clients are gay because they've experienced sexual trauma in childhood, these are myths that continue to be perpetuated and in some situations, and so those must be addressed as well. Again, it's important that the clinician educate themselves about LGBT terminology and the reality LGBT individuals face, while being able to be completely present with the clients and the specific issues that the clients bring up in their sessions during the therapeutic hour. Okay, and that's what you're going to get with my course. In my course, you're going to learn to refamiliarize yourself with the correct terminology, which is ever evolving. You're also going to look at the current and socio-political issues that LGBT people and their families face, as well as the historical context that LGBT people have grown up in, essentially. We'll look at the history of discrimination in the LGBT community, both with regard to the therapeutic community. As you may know, it wasn't until 1973 that the American Psychiatric Association removed homosexuality as a DSM category. Additionally, it wasn't until 2003 that same-sex relations were no longer criminalized in the U.S. Up until 2003, when the Supreme Court ruled on the Lawrence v. Texas decision, members of the same sex in a relationship could be thrown in prison, literally taken out of their home for the expression of love or affection, and thrown into jail because same-sex affection and sexuality was considered a crime in several states up until 2003, when again the Lawrence v. Texas decision struck down all remaining bans on same-sex sex. Also in this course, you're going to learn about the unique stressors that face LGBT people and their family and how to support them through that. You're going to learn about vulnerable members of the LGBT population, such as youth and seniors, and how to anticipate their specific mental health needs. You're also going to learn about the coming out stages and Vivian Cass's identity model. And in this course, I'm going to share with you important do's and don'ts when working with LGBT clients. For example, you do want to ask the client what specific terms they use when referring to themselves, rather than making assumptions. So, in other words, you may have a client who is currently attracted to, a female client who is currently attracted to another woman. You wouldn't want to make the assumption that she identifies as a lesbian. She may use the word gay, she may identify as bisexual, she may identify as pansexual, omnisexual, she may identify as heterosexual and having a relationship with a woman, and she may also identify as a straight man attracted to a woman. So you really want to know from the client how they identify and what their, not only what their sexual orientation is, but what their gender orientation is, and to know that those two things are separate, and we'll talk more about that. You'll learn the difference between, again, gender orientation and sexual orientation, which people often confuse and link together. Some don'ts. You don't want to assume what someone's sexual orientation is or their gender identity simply based on their presentation. And you don't want to assume that everyone is heterosexual. Again, when you're doing your intakes with a new client, asking more general questions. Are you married? What does your husband or wife do? In your recent relationships, have you had, do you date men and women? Are you attracted to both men and women, or one or the other? You want to ask broader questions because, again, a lot of clients may feel intimidated sharing who they are with you, and if you set the stage that you are open and you understand that heterosexuality is not the only sexuality nor the superior sexuality, then clients will be more forthcoming with you and be more likely to share their experiences. At the end of this course, again, you're going to know the stages of coming out and identity, the correct language to use when referring to or speaking with LGBT people. You're going to have a better idea of the general psychological issues that your LGBT clients may face, and you're going to understand the history of discrimination that the LGBT population has faced. And even though there is not a linear genetic intergenerational transmission of trauma, each new group that comes out, each new generation of LGBT people is still inheriting the past homophobia and heterosexism of the culture. So there's still a lot of shifting going on. Again, we live in a much better time period. Being gay is no longer a mental health issue in this country. It's no longer a crime in this country. However, there are still people who believe that being LGBT is a sin, or at the very least a birth defect, somehow inferior, and that heterosexuality is superior. So this course is really designed to familiarize yourself with the issues LGBT people face, and to be a therapist who is welcoming, who has a basic education about LGBT issues, and is going to be able to help their LGBT clients. So I hope you enjoy this course, and I thank you for taking it.